Hey guys, this is Dr. Jamie LaViola with Dental Masters of Alexandria, and we are here to welcome you with another episode of Ask Dr. J. Very often when patients come in, they ask me about whitening, bleaching, how to get their teeth lighter. And what I wanted to tell you is that first, whitening and bleaching are not the same thing. They actually have different definitions. And it's important to know the difference. So first, whitening basically is removing, or it's lightening your teeth by removing stains from the outside or the surface of the tooth to restore the natural color. So nothing gets inside the tooth. It's an external cleanse. And this happens when you get your professional dental cleaning. It happens when you brush your teeth. And the reason this is also important is I really want to warn people about using certain types of toothpaste that describe themselves as whitening, because how they do that is by making themselves more abrasive, which over time can cause something called toothbrush abrasion, or basically can damage or remove tooth structure, especially if you have any gum recession and the root is exposed. So be careful of those toothpastes that are described as whitening. Also, one of the more recent trends that I've seen are charcoal toothpastes, and basically there's no scientific evidence that says that these toothpastes work to lighten or whiten your teeth. You may have had a different experience, but that's just what the science and the research has shown. So let's talk about bleaching, because some toothpaste do have bleaching in it, but typically bleaching is going to be a process either with a over-the-counter product, take-home trays with professional strength bleach, and or professional bleaching in the office. And bleaching is actually using some form of hydrogen peroxide or carbamide peroxide, which is a derivative of hydrogen peroxide, and it's going to basically penetrate the enamel. It's going to penetrate the next layer of the dentin, and it will even reach the pulp, which is the inside part of the tooth, anywhere from 5 to 15 minutes. But it works by the peroxide penetrating and lightening the tooth from the inside out. So if you're actually looking to lighten the color of your teeth, bleaching is really the way to go. And as I mentioned, there's different ways, so let's kind of talk about those. First, you can purchase things that are over the counter, such as Crest white strips. There's a couple other ones, I think Opalescence. And really the only difference between over the counter and professional is the concentration of the bleach. It's going to take a real long time for people with a darker shade trying to get lighter teeth with a over-the-counter product, because the bleach concentration is simply too low. The next two, I'll go to the other end of the spectrum, is professional in-office bleaching. So this is a much stronger bleach for a shorter amount of time. It's done in the chair with dentist, dental hygienist, or assistant. And we have to actually protect your gums from the bleach because it's strong enough to actually burn your gums. And then there's the middle one, which is take-home trays, which will give you the same result as the professional bleaching. It's just that you have to wear them at home for a certain number of weeks. So that's how bleaching works. And the factors that you have to look at are concentration or strength of bleach, how long you wear it, or exposure time. Those are the two main things. And other things that are incorporated in bleaching that may affect sensitivity of teeth after are pH levels of the bleach, or how acidic is it. All right, since we know that over the counter, you're gonna get them from the store, follow the instructions, and they're not gonna really bump you up. Some people it'll work for, but it's not gonna give you a big bump. And professional bleaching, you pretty much come in and follow instructions while you're in the chair. So as it pertains to take-home trays, I wanna talk about how we do it here at Dental Masters and how our team will give you certain types of instructions. And you can use these if you have trays and already have the product at home to help you get better results. So first, it's really important, this may be obvious or not obvious, that you brush and floss your teeth first. Why? Because the bleach actually needs to make contact with the enamel to penetrate and do its job. So if there's plaque even a little bit on that teeth, the bleach is not going to penetrate in that area, and that's sometimes where you get spots that don't necessarily match or look right, or even less effective bleaching. Next, while you're going through this process, and even after, you're gonna wanna avoid foods that stains, and beverages such as wine, coffee, certain spices, tomato sauces, things that are gonna really not allow you to get the best result with your take-home trays. Trays, when you fill them, you want to use about the amount of a pea size, and you want to go around the tray, make sure you get it in there. And when you insert the tray, if you don't see any gel, you didn't put enough in, it's underfilled. And if a lot of gel runs out the top of the tray or the bottom of the tray, you put too much in and you overfilled. Very simple. So what we do is the next day, just adjust. So use the first day, you see how it goes. You don't have to start over, just adjust the next day. And and time of wearing trays. So there's all kinds of different protocols that you'll see on the market, and wear them overnight, wear them for 2 hours and 2 hours. Well, the fact of the matter is the evidence shows that the peak result occurs with the peroxide at 30 minutes. You're not getting much more bleaching after 30 minutes. So we don't recommend wearing them at night, because then you have all that extra peroxide dripping down. You might swallow it. It's just unnecessary. And so that 30 minutes is going to be what you wear for the first night. And then the following night, if you were sensitive after those 30 minutes, you can actually go as little as 15 minutes. So 15 to 30 minutes is our time range. We say 30 minutes the first night, so you know if you're able to wear them, then you can continue to wear them for 30 minutes each night. Okay, you've done your 30 minutes for the evening. What do you do after? You're gonna go ahead and rinse your mouth out. You're going to rinse the trays out with cold water. Do not use warm or hot water, because it can distort the tray. And then you're gonna put your bleach trays in your container or box that you've been given, somewhere that they're out. And believe it or not, do not close the container. We want the trays to dry out naturally and avoid any type of mold, fungus. So put the trays out, leave the container open, and let them dry out before the next use. So how long do we have to do this bleaching? Is it months? Is it weeks? Days? Well, it's gonna vary depending on the makeup of your teeth and the level of stain. So typically, on average, we tell people anywhere from 2 to 3 weeks will give them the desired result. You can go longer. If you're someone that has heavy stain from nicotine, it may take anywhere from 3 to 4 months. And if you have a condition called tetracycline staining, which is a very deep gray staining, this would be if your mother had tetracycline antibiotics while she was pregnant. You can get that type of staining. Those drugs are not used anymore, but I still come across people that have this. It could take anywhere up to 12 months of bleaching. There is specific systems that actually work better, that can do it faster, but these are for the vast majority of all professional dental bleach products. So varied times, again, depending on the makeup of your teeth and how stained they are. However, we're gonna expect for you to do it for about 2 to 3 weeks. Let's talk about the S word, or sensitivity, that may come along with bleaching. Why does this happen? Well, you have peroxide, again, that's penetrating the outer layer of enamel, hardest substance in the body. The next layer of tooth structure, which is called dentin, that'd be like the main part of the tree. The enamel's the bark. Dentin's the main part of the tree in the inside. And it even goes to the pulp, and that's where your blood vessel and your nerve is. And it reaches that, the peroxide goes through and reaches that anywhere from 5 to 15 minutes. So you're actually getting what's called a reversible pulpitis, which is basically a inflammation of the nerve that creates sensitivity, and it's reversible. This will typically go away in 1 day. So there's some things that you can do to try to help with the sensitivity. If you bleach before and you know that you're gonna get sensitive teeth, you may wanna take 400 milligrams of ibuprofen. That's gonna help with the first 6 hours post-bleaching, may be helpful. And the other thing is 30 minutes before you bleach, you can fill your tray with a alkaline toothpaste. So that's one that's not acidic. Or what we like is Carefree Pro Gel 5000. For main reason is that not only is it alkaline, but it has something called nanohydroxyapatite, which is you're going to see it in a lot of toothpaste, but in the Carefree Pro Gel 5000, it's been shown to be the most effective. I love that toothpaste, my opinion. I use it for brushing as well. And you should continue to use that through bleaching. But if you put that for 30 minutes and you wear that for 30 minutes in the tray before, it's been shown to help with some of that sensitivity. And again, you should only have that for about a day on average. So one more important tip that you really want to remember to consider is if you're getting any type of cosmetic dentistry, in other words, bonded veneers, whether they're ceramic or composite, bonding on your teeth. That means that they're changing the shape or color of one tooth with tooth colored filling material. Anything that's going to stick to your tooth in the dental world, you have to wait 14 days after your bleaching in order to get an appropriate bond and seal and have them last how they're supposed to last. Why? Because again, that bleach is going to penetrate the enamel and the other parts of the tooth, and it's going to affect the enamel and the saliva, and it takes about 14 days for it to recover to normal. There is a way that we can actually counter this so that we can bleach and go ahead and do our bonding right after that. It goes well beyond the scope of this video, but just remember, For the most part, if you're getting bleaching of any sort, make sure you tell your dentist, because 14 days before you put anything bonded onto the tooth. So overall, we talked a lot about the way that teeth are stained and how you can either whiten them or bleach them and change the color. And there's a lot to consider, right? Bleaching and whitening, different things, different concentrations, times, trays, no trays. But ultimately, this is something that I really want you to have a discussion with your dentist. Ultimately, you want to sit down, find out what your desired outcome is, if you're going to be doing cosmetic dentistry or not. Are you just trying to bleach? Are you bleaching with orthodontic trays? Because that comes into play. Is have a proper consultation and make sure you speak with your dentist about all the factors that are important to you so you can get the best result when it comes to bleaching. Thanks for tuning in to another episode of Ask Dr. J.